Thank you for taking the time to join us today for Why Should I Take the COVID-19 Vaccine? I'm Jack Malloy Cunningham, Vice President of Marketing and Communications, YWCA Minneapolis. We are happy to partner with YWCA St. Paul and Children's Minnesota to host this conversation to give us all a little more information on this very important topic. Communities of color have been disproportionately affected by COVID-19. And although everyone ages 16 and over are now able to sign up for the vaccine, we know many remain hesitant to do so. It is our hope that by validating these experiences while providing science-based information, we can help people decide what is best for themselves and their families. For those participating via Zoom, please feel free to use the question and answer function to post your questions or comments. And for those joining us on Facebook, feel free to post your questions and comments as well. This event is being recorded. Before we dig in, I would like to introduce the healthcare experts and leaders on today's panel. Dr. Gigi Chawla, Vice President and Chief of General Pediatrics, Children's Minnesota. Dr. Angela Gefford, Senior Director, Chief Education Officer, and Medical Director of the Gender Health Program, Children's Minnesota. Dr. Mark Gorelick, President and Chief Executive Officer, Children's Minnesota. Gay Adams Massey, Chief Executive Officer, YWCA St. Paul. Rosa Ruiz Mendez, Registered Nurse, Neuroscience, Children's Minnesota. Co-moderating today is Angela Miles, Vice President, Racial Justice, YWCA Minneapolis. Hamdi Sahal, Senior Administrator, Clinical Ethics, Children's Minnesota. Adrian Thornton, Registered Nurse, Infection Preventionist, Children's Minnesota. Also moderating today is Dr. Yahuru Williams, Chair, Professor of History, and Founding Director of the Racial Justice Initiative at the University of St. Thomas, and Board Chair, YWCA St. Paul. And last but certainly not least, James Burrows, Vice President and Chief Equity and Inclusion Officer, Children's Minnesota.
Since we have such a distinguished panel of experts, I'd like to ask if any of them would like to weigh in at this time on the historical traumas and how they continue to inform the way people feel and this mistrust that people have about vaccines.
I recently started reading here at Washington's book, and it is amazing to me because as old as I am, I was not aware of the other atrocities committed against African-American people starting in slavery. And when you think about how information travels within our community, word of mouth is stronger than any other communication tool out there. And so if you think about how our families have communicated via word of mouth about all of the things that has happened in our past, it's no wonder that we don't have fear and hesitancy when it comes to the medical community. And being a descendant of someone who was involved in the Tuskegee experiment, I know firsthand what it's like to be fearful of your future and how the medical community is going to treat you, but still realize that you have to at some point trust someone to help you because you have health issues that need to be addressed. And so I think that going forward, for me personally, I will be a better advocate for myself because I now know the history. And so knowing, all of that history for my people in my community will help me to be a better advocate now and in the future, but also to kind of facilitate advocacy among others in our community as well.
Thank you, Adrian. Anyone else?
Yeah, I would like to go next, kind of going off of Adrian, like it's not just like one specific event. There's so many events that we've been wronged so many times in the past. One for specifically Mexican Americans and Puerto Ricans was the eugenics time period where there was mass sterilization on women of color, immigrants, poor, mentally disabled, and disabled. And like Adrian was saying, it's not just like that event. There's been like all the way back to slavery, colonizations, the forced relocations, which makes it really hard to trust because it wasn't even always in the past either. It's now too with like the detention centers. Like people are coming in and this is how they're being treated. How are they going to trust doctors when they see similarities when they're being helped once they get here or stuff like that?
Thank you, Rosa. we'll move on to our next question.
Thank you, Dr. Williams. There has been a lot of misinformation spread about the vaccine, and we want to ensure that today we set the record straight and provide facts for our community. One myth that continues to be in the environment and in the atmosphere is that the COVID-19 vaccine is not safe because of how fast it was developed. Can you shed light on the facts around this statement? And I'm going to ask Adrian to begin with that.
Sure. So, I get that question all the time. And my director, her brother, has a very apropos way of saying it. They backed the Brinks truck up and just dumped it out so that we could get this vaccine. And so when we're creating vaccines, there are a couple of things that need to happen. First, you need money. Money, kind of funds everything. You can't do any studies without money. And vaccines are incredibly expensive to produce because you have to identify the source of the disease. Then you have to figure out, well, what do we need to do to manage the source of that disease? And so it gets really expensive to do that in a dish, and then in animals, and then in people. And so first you need money. Then you need time. And so usually what happens, because it's so expensive, companies will raise money that takes several years, and then they will do the initial studies. There are 4 phases to all clinical trials. And usually the phases run one behind the other, and each phase takes several years. And that's because you are doing fundraising, and you're also doing recruitment and testing in each of those phases. With the COVID-19 vaccine, because the US government said, you know what, this is very important, it is a public health issue, and we need to get this vaccine done and get it done quickly, they were able to run the first 2 trials and sometimes the 3rd trial simultaneously. So we didn't have to wait for the money. We didn't have to wait years for each phase of the trial to occur, and we were able to get everything done in a very short amount of time. In addition to that, COVID-19 is new, but the coronavirus isn't. The coronavirus has been around for decades. We've been studying it. We've been looking at it in a Petri dish for many, many years. And so it's not new. COVID-19 is, but because the coronavirus has been here and we've been studying it and we've been trying to figure out how we can prevent it from occurring, developing a vaccine really wasn't quite as difficult as people thought it would be. And so all of those things, the previous studies, the money that was provided, and the ability to do all of the phases simultaneously is why the vaccine was developed so quickly. No steps were missed. They followed the same process that we've always followed. We were just able to get them done quicker because everything lined up for us to allow us to do that studying all at the same time.
Adrian, thank you for that very thorough answer. I'm going to stay with you, but I'm going to also invite Dr. Shawla to weigh in on this as well. Are there special considerations or deliberations that people need to take before taking this vaccine? For example, would we still be susceptible to COVID after taking the vaccine? And if someone had COVID-19, should they still get the vaccine?
Thanks for those great questions, Dr. Williams. I think really important question that if you have had COVID-19, should you still get the vaccine? And the answer to that is yes. When you get COVID, the illness, you're getting one strain of the illness, and your antibodies towards that illness are going to last a finite period of time. You're only going to be protected for a certain amount of days or weeks. When you get the vaccine, the architecture of how the vaccine was created allows a little bit more protection against many different strains of COVID-19 and allows our immune systems to learn enough to protect for a longer period of time. We're still learning how long that will last, but we do know that it will last longer than if you are just counting on the antibodies and your natural immunity.
And I would add to that, when you're thinking about getting the vaccine, everything is a risk-benefit kind of decision. And so if you have fears and you have apprehensions, that's okay. We're not saying that your fear is unwarranted, but don't let that fear make the decision for you. Ask questions. Find a trusted healthcare professional that you know and that you trust to give you accurate information, and ask your questions, and ask the questions until you feel comfortable enough to get the vaccine. Those are the things I would consider. From a health standpoint, really there are no considerations that should be a barrier to you getting vaccinated. So again, just, ask questions, ask as many questions as you need to get the answers that you need.
I frequently have young people, young adults, and even their young parents think that they don't need to get the vaccine. And they are worried that the side effects of having the vaccine, maybe the arm soreness or being a little bit tired for a day, is potentially worse than actually having COVID-19, because they believe that if they get COVID-19, they're going to be completely fine and they'll not experience any signs of illness, or if they do, it's only going to be a very mild illness like a cold. And I think what we're really recognizing is that we can't predict what the illness of COVID-19 is going to be like for anyone. And young people are really experiencing a lot more illness than people ever thought. Young adults, teenagers, they are getting sick, they're getting hospitalized, they're having long-term symptoms and complications. And so the side effects of having a sore arm for a day or fatigue for a day weighed against the potential for a lot of long-term problems should also really be considered strongly when you're making your decisions.
Thanks, Dr. Chawla. I'm going to add one more thing from a pediatric perspective. The way that viruses work is that they try to go wherever they can so that they can live and thrive and replicate. And one thing that I think a lot of people don't realize when they're considering getting children vaccinated is that if we vaccinate all adults and we leave children out, we're effectively making children more vulnerable because the virus will selectively target them as unvaccinated hosts. And so if we really want to protect kids in our entire community, we have to ensure that kids are getting vaccinated too. And it's something that we're already seeing in the fact that the percentage of new COVID cases that are showing up in kids is larger now than ever before. And that's likely because they are unvaccinated as more and more adults get vaccinated. So as we look toward getting ourselves vaccinated and our families and our kids vaccinated, we really have to think long-term about what are we trying to do to protect our whole community and how do we keep everyone the most protected, including kids, going forward.
Thank you all for those responses. I wanted to touch a little bit more on, is it safe to take the vaccine for women of childbearing age and during pregnancy? And then additionally, can you share with us more information about the plan for children to be able to take the vaccine? And Dr. Chawla, I'll start with you on that first question about women taking the vaccine during pregnancy.
Oh, so sorry. Yes, I think during the trial period for the vaccine, there were pregnant women involved in the trial to test the vaccine and make sure that it was safe for women and for their unborn babies. And from what we know, all of those studies were very positive. There was no untoward effects. Since that time, there's been ongoing review and analysis, and it continues to show there is there's no challenges to the pregnancy, there's no challenges to women, and that the fetuses and babies all do very well. So from everything that we can tell, there is no problems with pregnant women getting the vaccine.
And adding to what Gigi said, if you look again at the risk versus benefit, when you're looking at the vaccine versus the complications associated with getting COVID-19. We know that pregnant women have not done well when they have gotten COVID-19. They get severely ill. Their babies don't do well. They go into preterm labor more often. And so from a risk-benefit standpoint, the risk is greater of having complications with your pregnancy if you get COVID-19 versus getting the vaccine. And so if you want to have the most benefit for you and your baby, then getting a vaccine is a better option.
And I'll maybe jump in with a part about kids, and there's some questions in the chat about 12 to 15-year-olds. And so we're hopeful to get news any day now that we'll be able to vaccinate 12 years old and up. And just to be clear on the process around that, and Adrian can certainly correct me if I'm wrong. So this is the exact same vaccine. And I think that's really important for people to understand. We're not developing a new separate vaccine for kids. This is the same vaccine that all of us have been getting since earlier this year and end of last year when we all started getting vaccinated. The issue is that immune systems in children work a little bit differently than immune systems in adults. And so we need to study the doses of these vaccine in kids to make sure that we're giving kids the proper dose of the vaccine so that they have the correct immune response and can be as protected as adults from getting the same vaccine. So we don't need to do all the first part that Adrian was talking about developing the vaccine. We already have it. So now what has been ongoing has been trials in kids of different ages to see how the dose effect works for them, so we can be sure that they're getting the same protection in a younger person with a different functioning immune system as an adult. And 16-year-olds, generally, their immune systems function about the same as adults, which is why they've been approved to receive the current vaccine. And so the studies have sort of closed for the 12 to 15-year-olds, and we're waiting for approval. And there are ongoing studies right now in kids 2 years old and up. So my fingers are crossed as a parent of 2 7-year-olds and a 5-year-old that by the end of 2020, I'll be able to get them vaccinated too, but we shall see.
So I want to ask the panel, and we don't have a lot of time left, so I'm going to pose this question quickly. There has not been a clear understanding of the long-term effects of the vaccine. Could you provide any information that might alleviate people's concern about these long-term effects? Is there evidence, any evidence, that supports the idea that communities of color are affected differently than other races when taking the vaccine?
Yeah, we haven't seen any evidence to date. And keep in mind, the trials started in 2020 for the vaccines. They're going to be ongoing for another 3 to 4 years, because just because the vaccine is out and it's being administered does not mean that those trials stop. So the people who were in the initial arms of the studies will continue to be studied for the next 3 to 4 years. That's number one. Number two, what we know, again, risk versus benefit, some people that get COVID-19 have long-lasting effects. They have what they call foggy brain, where they're having trouble concentrating and focusing. Some people continue to have headaches long-term, 6 months to a year after having COVID. Some people have other neurological function issues as a result of having COVID-19. We have not seen any of that with the COVID-19 vaccine. We haven't seen anybody have any long-term effects. Most side effects occur within the first 2 to 3 days after getting the vaccine, and then they're gone. We haven't had any reports of anyone continuing to have those long-term issues. There are some people that are still experiencing headaches. We're not sure if that's related to the vaccine or related to some other process that was manifesting itself, and then the person got the vaccine and it manifested more. And so those trials will continue to be ongoing, and we'll find out if there are long-term effects. That's one of the issues with this vaccine, is people want to know right now, is it safe 10 years from now? And we won't know until 10 years from now, but the early studies are very positive to indicate that we won't have any long-term effects related to the vaccine. But again, we know there are some long-term effects related to having COVID-19. So risk benefit, the benefit is outweighed with the vaccine versus actually getting the disease.
I've got a few questions I want to ask, and I want to try to get through them, just a couple of them, as I see some that are relative to questions that are coming up in the chat. First question is, what are trusted sources of information regarding the vaccine? Adrian, can you share with us?
I can. So as a medical professional, of course, I'm on the CDC website all the time. I read the actual journal articles that are published related to COVID-19 and the vaccines. And I will tell you that I often will get very exhausted reading those. So they're public though, so if you want to read that information, you can. Two other sources that I go to are the Washington Post, which they do a fabulous job of taking really, really complicated information and making it understandable for everyday people. And so, for instance, if you go to the Washington Post website and you look at their explanation of the Pfizer and Moderna vaccines, because they are mRNA vaccines, they really break it down into simple, understandable terms in terms of how the vaccine works. And so that's one place. Also, I love Bill Nye the Science Guy. My kids grew up on him, and I've done some work with young people over the past few months trying to understand COVID-19 as well as the vaccines, and even wearing a mask. Why do I need to wear a mask? How does it work? And Bill Nye the Science Guy, again, does a really great job of taking something that's really, really complicated and making it easy to understand. Another trusted source would be your own healthcare professional. I would hope that people are able to identify and find healthcare professionals that they can trust. If not, you can reach out to anyone on this panel, and we can either help you identify a trusted healthcare professional, or we can, be that trusted person for you. My trusted person is my director, who happens to work with the CDC on all of the vaccine decisions. But because I have a daughter who has asthma and I have a special needs son that has lots of health issues, and because I myself have Raynaud's syndrome as a result of my grandfather reportedly being a part of the Tuskegee experiment, I have fears, I have questions, I have apprehensions. I trust my physician, but I also trust my director. She is a friend. She loves my children. I trust our lives, my children's lives with her. And so I go to her with my questions all the time. And I will read something, and if it doesn't make sense, I'll say, well, this is how I interpreted this. Is this true? And so it's very important for you to find that person. They're out there. North Point Health and Wellness has some really great physicians and providers there that are willing to talk to you and give you guidance and help you to better understand COVID-19 as well as the vaccines. So there are resources out there for you. It's just a matter of finding them.
Great. Thank you so much for sharing those resources. I'm seeing more questions coming in on the chat, so I want to get to some of those questions that are related to the ones we had prepared to ask. There continues to be a ton of information published related to the different rates of efficacy for the vaccines. Is one vaccine better than the other? We've all seen and have heard information about the J&J vaccine. Could you shed some light on that for us?
Sure. So, when you're looking at efficacy rates, they're looking at several different things. Is it effective against the virus? Is it effective at keeping people from getting the virus? And one of the issues we have right now is that all of the vaccines were trialed at different time periods. And so their efficacy is going to differ depending on which strain was circulating at the time. What people really need to focus on is all of the vaccines are 100% effective at preventing severe illness due to COVID-19, and they're 100% effective at preventing death related to COVID-19. That's very important because Black and Brown communities are more disproportionately impacted by severe illness and death related to COVID-19 disease. And so all of the vaccines 100% prevent that from happening. And so I wouldn't let the other efficacy rates really impact your decision, because again, unless you're reading all of the articles and the studies that went into it to understand those efficacy rates, then it gets a little confusing. Focus on what we're really concerned about, which is severe illness and death, and they all 100% prevent that.
Yeah, and I would maybe just clarify that getting, because this was a question that was asked earlier, getting the vaccine doesn't mean that you won't get COVID-19. It means that if you get COVID-19, you are not going to die from it, and you will have a less severe course of illness from COVID-19. So it doesn't mean that you will be completely protected from ever getting the virus, but it means that it will keep you safe if you do get the virus. Though I will add that because we continue to study these vaccines ongoing, we are actually finding that the vaccines are close to 100% effective from getting people from helping people to get the virus altogether. So 92 to 97%. So it's working much better than we had even hoped for people getting the virus at all. But there's not 100% chance that you won't get COVID-19 at all, but it will keep you safer if you do.
And it will keep others safer because it decreases the chance, even if you get COVID-19, of spreading it to anyone else.
Thank you. Dr. Williams, I think you had the next question.
Thank you, Angela. We're actually going to go to the chat now and try to get some of your questions answered in this period, since we are running short on time. One of the first questions that's in the chat is from Lisa Garcia. I have concerns about the pharmaceutical companies who've been convicted of trial manipulation. Why should we trust them now? Adrian, you talked about risk reward. Anyone of our panelists want to weigh in on why it's important for us to recognize that risk reward ratio? Dr. Shaw, I think you were about to speak.
Yeah, I was going to mention, I think there's been a lot of comments in the chat about how do you trust the pharmaceutical industry, and I guess the way that I would respond to that is, right now in the middle of the pandemic, there is so much heightened awareness and oversight over every aspect of vaccine development, efficacy, and study. In fact, the whole world is watching. And so I think this is a time where, although in the past there may have been concerns about trials and how things may have been interpreted, with the entire world overseeing every aspect of its development, I think that degree of transparency has at least helped healthcare providers understand that this vaccine, all the vaccines that are there to prevent COVID illness, they are safe. So, when we look at our own healthcare provider rates of getting vaccinated, we are astronomically high at recognizing that this vaccine is safe. We do it for ourselves, we do it for our children. And from that standpoint, I hope that by our evaluation of looking at the science and understanding it, that could also be reassuring.
We'll take another question from the chat. COVID vaccination wearing masks seems to be a political issue as well. Some are refusing the vaccination because of political views. Any recommendation on addressing this?
To bring in Hamdi and Rosa, because we've had these conversations ongoing, and just how do you talk to people who are refusing to get vaccine or don't agree with it? Hamdi and Rosa, we talked about this in our last ERG panel. Would you like to share your thoughts on that?
Yes, I would like to add that this is not a political thing. It's affected the whole world. I understand that there's a lot of hesitation within communities because of the history and trauma. My community talk about how they were asked to take a vaccine in Africa in order for them to get their bag of rice for that month, without not knowing what the vaccine was all about or what was in it. But I think this time it has affected the whole world, and as Dr. Chichi said, the whole world is looking at it. This is something that we all have to take to protect our families, our kids, our communities. And the other thing I've always tell people is that the CDC first recommended for the health professionals to take the vaccine. That shows how much trust they had in this vaccine. Most of us sitting here talking to you today had the vaccine. After I took mine, I was able to talk to my family and said, I took it, I'm okay. You guys are able to go ahead and take it as well.
Like Hamdi was saying, kind of like I got it. I told my family I've been okay. Now my parents have got it, my aunts and uncles. And the biggest thing is probably the benefit versus the risk, like we've been talking about. I work at the bedside and we've had a few missed kids. So that's one of the illnesses that can happen to kids after they have had COVID after like a month or so. And it's really sad to see these families come in and be like, how have we prevented this? Because usually these kids are really sick and need a lot of support. And their hospitalization is quite a few days for them to get better. And then I see families saying, I'm going to start vaccinating my kids, but we don't want to wait until then, until their kids are very sick, and we don't know what can happen until they decide to get the vaccine. So probably, like we have been talking about, the benefit versus the risk of getting the vaccine versus getting super ill and maybe not making it through.
Thank you, Rosa. Another question that's come in is touching on some of the same things in relation to possible serious side effects of the vaccine and when you should consult with a medical provider.
There are some expected side effects that, should be gone over at the time that you get your vaccine. And we've talked about a few of them here in terms of arm soreness, fatigue, possible fever, headaches. I think the short answer is anytime you're worried, you should talk to your healthcare provider. So anytime you're worried, you should call the nurse line or wherever it is that you get your care to ask questions. And as someone who's worked in pediatrics for 15 years, I can tell you I'm always happy to answer a question from a family when they're worried about their sick child. So always call. But I think if you have any side effects that are outside of what is expected, what you've been told are likely side effects, and it worries you, you should call. I would, err on calling, even if it's just for reassurance, than sitting at home worrying that something is going wrong when it might be just
Thank you. Great advice. Another question is, we're going to shift gears a little bit, and this question is around thoughts on the introduction of vaccine passports, particularly for Black communities. Can someone share and shed light on that?
I go back and forth. I recently returned from vacation, and I thought, it would be really great to know that everyone that is vacationing around me has a vaccine passport that says I've been vaccinated. On the other hand, I am not in agreement with using them as a penalty to people who don't get vaccinated. So I can see both sides of it. I don't know that it would work. I think, we're already hearing that people are paying top dollar to purchase illegal vaccine cards. And so if we have a passport, will that help the situation or will that hinder it? It could go either way, but there's good arguments on both sides of it. So it's a gray area. I would love for it to be black and white, but from my standpoint, I think it's very much a gray area, and it could be positive and negative.
Yeah, and I'll just add that around the world, this is already happening in several countries with vaccine passports. I just spoke with a colleague in Israel, and they have electronic vaccine passports there. So you hold up your smartphone, and then there's a little moving thing that tells you if you're vaccinated or not. So it can't be replicated. You can't take a picture of it, and it can't be replicated, and you have to have it on your phone. And I'm sure there's ways to hack around that because you can always get around everything. And while I agree with Adrian, I do like the idea of, certainly some voluntary activities requiring vaccination. I worry that as sophisticated as we may have to make the passports, it may end up just denying access to certain spaces for people who can't access an electronic passport or be able to prove their vaccination status. So I think it is, there are pros and cons to that idea, I think.
want to ask the panel, would you equate the vaccine, would you say it's like the flu vaccine? That's one of the questions that's been asked is this like the flu vaccine? How is it similar? How is it different?
You know, all vaccines are different. It's different in that it's targeting a different organism. It's different in the way that the efficacy of the vaccine is delivered. And so, you know, people keep trying to compare COVID-19 and the vaccine to flu and flu vaccine, and it's not an apples to apples comparison. And, you know, people are like, well, do we have to get it every year, the vaccine every year, just like we do flu vaccine? Chances are we will, but we don't know because, again, the trials for the vaccine are ongoing. And so as we continue to study people who started in the trials last year, we'll find out what their antibody levels are, and we'll find out how much protection they're getting and how long that lasts from the vaccine. But, you know, I think there's a danger in comparing it to flu vaccine because they are two different vaccines. And, you know, one is newer, one is established. And so you really can't compare the two in terms of looking at similarities, but they're both effective. And so that's where they're both similar. They are both very effective vaccines.
Thank you. There's another question in the Q&A, and this is going back specifically around the Johnson & Johnson vaccine. How have you been addressing hesitancy about that vaccine after their pause?
Again, it's a risk-benefit analysis. And so I've told people, if you're diagnosed with brain cancer and the doctor says, well, we need to do brain surgery on you, but there's a risk that you'll die in the surgery, there's a risk that you'll be paralyzed as a result of the surgery, you would not say, I'm not going to have this brain surgery because there is a risk that I might not wake up or I might not walk. What you're going to say is, you know what, this cancer is definitely going to kill me, and I will definitely not be able to walk, and I will definitely not be able to talk. And so looking at risk benefits, you would have that brain surgery. And it's the same thing with the Johnson & Johnson vaccine. We know now in which people it causes the blood clots. And so what happens is in certain people that for whatever reason, they have a low platelet count, when they receive the vaccine, it is causing blood clots in certain parts of the brain. Those same blood clots develop in those people when they take some people when they take birth control pills. And so if you look at the risk versus the benefits, have people died as a result of these blood clots? Yes, 2 people have died. Have people been really ill? Yes, but that is because we were unsure of what was causing it and how to treat it. Now we know how to treat those blood clots effectively, and we know how to prevent people from dying from those blood clots. Now that we know that, the risk benefit again is if you get COVID-19, you are much more likely to get severely ill and or die. If you get the vaccine and you develop these blood clots, we can treat you to make sure that it doesn't cause any long-term or short-term effects. And so when you're looking at the Johnson & Johnson vaccine, they've looked at the science, they've studied the patients, and we didn't know this would happen initially when it was rolled out under emergency use authorization, but now we do know. So we know how to treat it, we know how to prevent death and you know, severe reactions to it. So when you're looking at the Johnson & Johnson vaccine, again, it is 100% effective at preventing severe disease related to COVID. It's 100% effective at preventing death related to COVID-19. If you are a person, specifically a woman that experiences a low blood platelet count for some reason, you should consult your physician and perhaps look at an alternative vaccine. So that is how, we're addressing it now. But again, if people have questions, ask your questions, ask your health provider, and continue to ask those questions until you get the answers that will help you make an informed decision.
Thank you, Adrian. Before we wrap, we want to give each of the panelists an opportunity to offer a final message to friends, family, and loved ones that are considering if they should get vaccinated. What would your message be as we prepare to close? We'll start with Dr. Chawla.
Yeah, thanks everyone today. I'd just like to make sure that people know that this vaccine is really there to save lives. And I know that people have a lot of worries. They have a lot of worries about side effects. They have a lot of worries that what if they're the 1 in 100 million who gets a blood clot. But I think when you're looking at the risks and the benefit of this vaccine, not just for yourself, but for the rest of your family, for your children and for their friends, and for your ability to get back to a new normal for yourself. I think this vaccine, all of them for COVID that are available, is just absolutely the best option.
Hamdi? We'll go to Adrian, final thoughts?
Yeah, so, again, I have a special needs son, and he means the world to me. And I have done a lot to get him to where he is. He's 27. He's had, multiple heart surgeries and kidney surgery and surgery on his knees and his legs and his feet. And, it would tear me apart to know that he died from a vaccine preventable disease. And so what I always tell people is that, in addition to doing it for yourself, do it for your community, do it for your family, do it for your loved ones, because we all have someone that we care deeply for. And if you want to protect them, then getting the vaccine is the best option that we have right now. I actually lost my adopted mommy about a month ago from COVID-19, and she had chronic asthma. And her doctor continued to tell her, oh, it's just your asthma, it's just your asthma. And it was her asthma, but it was because of COVID-19. This Mother's Day was awful because in addition to my birth mother and my adopted mommy, I have no one now to celebrate Mother's Day for, except, my sisters, of course, but that was very painful. And there are a lot of people who had to experience Mother's Day without their mothers because of COVID-19. And if you could go back and give them a vaccine so that they would be here for another Mother's Day, wouldn't you do that? Something so simple as a shot in the arm, so just remember that it's not always about us, it's about the people around us and protecting them and making sure that they continue to be here to celebrate with us when this is all over.
Thank you, Adrian. Hamdi?
Sorry, yes. When the pandemic started in February, I had a baby at that time, and everything was so difficult. I didn't allow no family to visit. So please go out there. It's okay to ask questions. It's okay to be hesitant. Educate yourself. Do it for your family. Do it for your loved ones. Do it for your neighbor, for your community. It takes all of us to get this through.
Thank you, Hamdi. Rosa?
Similar to everyone else, just because it saves lives, do it for your family, your community. It's okay to be nervous. I was nervous too when my parents first got it. It's scary, but it's for them to live longer. Like Adrian was saying, hopefully celebrate future Mother's Day, Father's Day, birthdays, and hopefully get back to a new normal.
Thank you, Rosa. Dr. Angela?
Yeah, I think what I would add maybe to the conversation is speaking directly to my community as a member of the LGBTQ community. Dr. Williams, at the start of the talk, you talked about the historical trauma in the medical field for communities of color and medical experimentation. And while the LGBTQ community doesn't have that shared history, one thing we do have in common is that we are also disproportionately more likely to get COVID-19 than others, both because of our lack of access to healthcare, our higher rates of chronic illness and conditions, and really our fear of going to doctors because of being treated poorly based on stigma and discrimination in the past. My community has had to fight really hard to get treatment for diseases that uniquely affect us, and I'll use HIV as an example. So in the 90s, we had to storm the streets to get the medical community to pay attention to a disease that was ravaging, particularly the gay community, but the LGBTQ community. And now we have a disease that is disproportionately impacting our community, but we have a solution and we have a vaccine. And I feel like this is our shot. This is our shot to change that history. This is our chance to get this vaccine that can keep our community healthy, and we should take advantage of it. And I really get frustrated with people who have a lot of privilege and have always felt very comfortable with the medical community, particularly those in the white and more wealthy and cisgender communities who refuse the vaccine because I feel like they have the privilege to do so. But what I would say to my friends and family, obviously, is what everyone else has shared: get the vaccine, not just to protect yourself, but protect others. But what I would say to my LGBTQ family is, you know, we are more likely to get sick, and let's do this to keep ourselves safe. We deserve it. We deserve to be here, and we deserve this vaccine.
Such a great point. We all have to remember that it takes a village, and we are the village. Thank you, panelists, and thank you, Angela Miles. It's been great to work with you. We'll turn this back over to Jacqueline and to James.
We thank everyone for participating today and hope you learned more about the vaccine to help you decide what is best for yourself, your family, and your community. I should also mention that in partnership with Children's Minnesota and YWCA St. Paul, in addition to many other wonderful community partners, we are hosting a free vaccination event on May 22nd at YWCA Midtown from 10 a.m. to 3:00 p.m. Pre-registration is not required, and please visit ywcampls.org/vaccine to learn more. I now turn it back over to James for any final words.
Thank you to our panelists. Thank you to this wonderful audience. Thank you, Jackie, for your partnership. Thank you, Gabe, for your partnership. And we hope we answered questions for you. One of the things we have to remember is when we talk about vaccines, we're layering vaccines on top of systemic racism within healthcare. We're laying it on top of systemic bias against the LGBTQ community in healthcare. So we have to understand that people will have questions, they will have doubts. So hopefully this answered some of yours, but continue asking those questions. We'll continue to provide answers because we want our communities to be safe and our communities to have access. I lastly wanted to just thank also MDH for partnering with us on the vaccine event we will have on May 22nd. It's very important that we have access to that and access in our communities. And we'll have folks there to answer questions as well. We won't be just giving the vaccine, we'll also be answering questions, and we'll also have community partners who look like you, who can partner with you, who give you the vaccine from your communities as well. So thank you very much, everyone. Hope you had a great time and this wonderful event. Thank you.